From the JAMA Network, this is JAMA Dermatology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Dermatology.
Hello and welcome to our listeners around the world. You're listening to JAMA Dermatology Author Interviews. Thanks for joining us. I'm your host, Dr. Adamson, the web editor for JAMA Dermatology. The concept of the term skin of color has advanced health equity within dermatology by catalyzing reforms in medical education, clinical imagery, and research priorities, spotlighting the unique morphologies, treatment responses, and disease burdens across various skin types. However, emerging largely within the United States racial and ethnic discourse and context, the term does not map neatly to global pigment diversity. In a new viewpoint published in JAMA Dermatology titled Reimagining Skin of Color, a Pigment-Informed Framework, authors discuss the term skin of color and ways in which the term can be adapted to various settings. Dr. Rashmi Sarkar is a professor in the Department of Dermatology at Lady Hardinge Medical College in New Delhi, India. She's the past president of the Indian Association of Dermatologists, Venerologists, and Leprologists. And she's the current president of the Pigmentary Disorders Society. She is a senior author of this viewpoint and here to discuss this work. Welcome, Dr. Sarkar.
Thank you so much for inviting me for the podcast.
Would you mind, Dr. Sarkar, introducing yourself? What type of niche do you inhabit in dermatology?
Absolutely. So I work as a director professor, which also means a senior professor in the Department of Dermatology at Lady Hardinge Medical College and Associated Hospitals, New Delhi, India. This happens to be one of the oldest medical colleges in the country. And my work is, teaching undergraduates as well as postgraduates of dermatology. Then I also see patients in the outpatient department and also in the wards, attend emergency duties, but most importantly, also engage in research. And my two special areas of interest, I would like to say, is pigmentary disorders as well as pediatric dermatology. And I've also been introduced to the Skin of Color Society more than about 2 decades back, right here at the American Academy of Dermatology.
And as you mentioned, your introduction to skin of color came through your interaction with U.S. dermatologists.
Yes.
Do you mind telling the audience when you first heard the term, what was your concept around it, or, how did you think about it?
I was introduced to the Skin of Color Society way back, about 2.5 decades back when I came as an invited speaker to the American Academy of Dermatology in San Francisco. And I was rather curious about the term, reason being, for me, skin of color broadly meant patients with dark skin. That is what it meant to me. And the word skin of color was a bit curious because skin is going to have color. Even if you're a European skin patient, you're going to have color. There is going to be pigment of the skin.
Yeah, if you're of European descent, you also have color in your skin.
Absolutely.
That's exactly right.
So, that's why I thought that the term has to be more expansive. That was one thing that came to my mind. The other thing is, when you look at the word skin of color, sometimes it is used interchangeably as tone, skin tone, but it could also mean, especially in the Asian and the African context. I come from, South Asia. Could also refer to colorism, which is also more to do with social identity. So somewhere, although the term was started very simply, it's a university accepted term and quite empowering, but at the same time, it's used too broadly now and maybe sometimes also very vaguely. So me and my co-author, Dr. Hitaishi Mehta, that it should be more practical. And that is why we suggested a pigment-informed framework in this particular article.
Yeah. And I also want to highlight that you're correct. It is a U.S.-centric term. It was popularized and created in the U.S. context. And some of the reasons for that relate to the social, political consequences of coming from certain racial or ethnic groups, where perhaps the representation in images, in textbooks, or in teaching materials
Yes.
did not reflect the diversity of skin tones and reactions to, say, lasers or certain medications or scarification. And so I think as it was conceived, it really helped highlight an area that was of need. Do you think that's a fair assessment?
Yeah, I agree with you because one good thing about this is that it brought into focus a lesser known group of patients, you could say, because we are referring to patients who were skin of color, that is, as I said, dark skin patients. And in a way, it maps those belonging to Fitzpatrick skin type, say 4 to 6. But this itself actually is a little difficult to understand because if you look at the Fitzpatrick skin types from 1 to 4, it actually refers to skin that burns or tans. And whereas 5 and 6, when we come to that, it then talks about certain presumed phenotypes, dark skin and, very dark skin. So what happens is it was probably made more to see the reactivity of the skin to UVA radiation, more to do with photoprotection maybe, and also treatment, which was there. But in some ways, it does not talk about the various things that we have referred to in this article. That is, like the skin tone. It doesn't just mean only the skin tone. It also refers to ancestry, also to the socio-cultural context which is there here. And also, as you very well put it down, what is the outcome of this pigmented skin, which could be maybe to scarring, the inflammatory response, or even the post-inflammatory, hyperpigmentation, which is there. So I think that's true that there are certain things which are very good about this term, skin of color, because it highlights that there is a group that needs more attention, whether it's the color atlases, whether it is the teaching curricula, or whether it is even in editorials or whatever our write ups are. But at the same time, this is where it has to be more expansive.
Yeah. And if we look back at one of the first mentions of the term skin of color in article by Dr. Susan Taylor, it was described more broadly related to individuals of African American descent, Asian descent, Native American origin, Hispanic. So very broad, but in that context, pigmentation and pigment density is extremely vast, right? And then as a consequence, skin of color has also then been used in the Fitzpatrick scale, which was originally developed, as you stated, as a reaction to UV exposure, and originally wasn't necessarily meant for those of darker skin types, and only later on were Fitzpatrick 5 and 6 added. But that scale wasn't necessarily then meant to describe skin tone across the Fitzpatrick type, because it's about the actual reaction to UV, which is related but not necessarily exactly the same thing, right? You can have some photosensitivity and be maybe a little bit of darker shade than lighter shade, as an example. So you're right. The term skin of color had started to just be conflated with all of these similar but distinct differences, whether it's reaction to UV, the social political context, reaction to inflammation. And so what your viewpoint is trying to do is trying to find ways to disentangle this. And so now we've talked about some of the limitations of skin of color. What do you see as like a path forward? Should we just throw the term out? Should we add maybe caveats to it? Can you explain how you think we should maybe conceive this?
I think there's been a lot of good with the term skin of color also, because the very fact that it's a short term, it's used as keywords in so much of our dermatology literature. So that way it has brought in a lot of focus to this particular term. Otherwise, we would not have thought about it or not have thought of even increasing our color images, including it in our curricula. So we should definitely not throw it out. But having said that, we do have to make it more expansive.
What do you mean by that?
What I mean by that is, like, in our viewpoint, we have built a scaffold. We said that we should put it in 4 layers because, as a dermatologist, when you're examining a patient, these are the 4 things. See, the Fitzpatrick skin types, which cannot be used as a proxy term for only skin tone, that is the pigment phenotype, or say for race, or even for the social status. But on the other hand, these are the four things which we have suggested in the pigment informed framework. The first being, of course, the pigment phenotype, which is the tone. And the skin tone actually can be accurately measured by a few different measurements, one being the ITA, which is the individual typological angle, or say the melanin index, which is there, or the monk skin tone, but that again is computer generated. The second is ancestry. I think very rightly it has been pointed out that, there could be two people having the same Fitzpatrick skin type, let's say skin type 4, but one could be South Asian and one could be, say, Brazilian. So again, the skin is going to be different because of the ancestry, the distribution of the pigment, and the reaction is going to be different. So even though it's the same skin type, Fitzpatrick skin type. The third type again would be the socio-cultural context. For example, say a young female would have a lower self-esteem because of some of her pigmentary conditions, say melasma or post-inflammatory hyperpigmentation. Or say in India, if a patient has vitiligo, and this is something the patient has to be very careful about because it kind of plays an important role in his prospects in his or her career or even marriage. So these are certain things, which have to be taken into account in the socio-cultural context.
Right. And then the fourth framework component?
Yeah, the fourth one is, of course, the outcome, due to the pigmented skin. For example, there is a different way of scarring, scarring or post-inflammatory hyperpigmentation, the response that is there, or even keloids. So all this is also different because of the global diversity which is there of the skin and all. And nowadays we have so much of global movement, so we have to be familiar with all the pigmented phenotypes, each of us.
And I know we've mentioned that the term skin of color was born in the U.S. context. How would you understand that term, say, in your context outside of the United States, in India? Is it a term that has some usefulness? Because in the subcontinent, I mean, there are folks that are very fair, right? More fair, say, than some people from Southern Europe.
Yes.
And there are folks that can be as dark as many people in sub-Saharan Africa. So how does that term function in your context? And also in the subcontinent in India, there's a lot of ethnic diversity as well.
Absolutely, yeah. There is, in fact, skin type 3 also, Fitzpatrick skin type 3, because in the northern parts of our country, you do have very, white-skinned people. So you do have skin type 3, and you would have very darkly pigmented skin also down south, because it's a huge country. So we used to just call them patients with dark skin, but at the same time, now the word skin of color in some way has caught on, reason being, it's used in the literature, in the dermatology literature. It comes in the keywords. So people understand that we are talking about probably dark skin, and that is where the scaffold is handy. Because we talked about ancestry, we also talked about these four different things. So in a way, you could say that even in, say, South Asia or India, you are actually having different types of skin types, yet it will be very different from type 3 Fitzpatrick skin in the USA or in Europe. It's going to be different.
So in the Indian context, is everyone considered then skin of color? Because in the US context, that's what someone would say.
It's an interesting question, actually. Makes me think, but when I've asked this question to a couple of people, they just feel that it's our normal skin, actually. So it's not really skin of color because that's our original skin. That is somewhere varying from light brown to very dark brown skin. So I think this is used more in dermatology literature, something that we've come to understand. And I'll tell you something interesting. I'm editor-in-chief for a book for Adewole, which is also dermatosis and skin of color. This is the first which is coming out from probably South Asia. And we thought that we know everything about it because we are skin of color perhaps. But when we started doing it, we realized no, there's so much more to it. And that is in fact how we thought of this framework also. And we have a lot of global authors that there's much more ramifications than just thinking that, we are already darkly skinned people. So we're not really skin of color because it's our normal skin. So it has a lot more to it. And that is why it's a term that has to be more practical.
And I think because this term also has some social cultural components to it,
Yes.
that over time it may wane as a term, right? Or it might change.
Yeah, it might change because it's accepted well in the dermatology circles and some people. But as I said, it should not denote something like colorism. So that is again something that it might undergo some modification. Maybe it doesn't undergo a change, but it may get modified slightly over the years.
Do you think in the global context, the term may have some negative connotations associated with it?
As a dermatologist and as a researcher, I completely understand and accept it. So it doesn't exist maybe for people like us because we understand, where it's coming from. And that's what we've written in the viewpoint that if you want to have better treatment outcomes and diagnosis, we have to understand and focus on that. But regarding whether it can be changed or not, I don't know because I think a lot of good work has been done because of the term.
And coming from a country that has a lot of diversity related to ethnicity as well as skin tone, do you find the latest surge in interest in, quote, skin of color has had an impact on, say, how diverse textbooks are, teaching materials are in India or other places within Asia? Has it had an impact?
Yes, very much so, because one is that there's a lot more awareness. So, as you said, the color images are very important because dermatology is all about images, as you know. So, what's happened is most of the images that were there, a lot of them were skin diseases and white skin.
Can I stop you for a second? In white skin, do you mean like in European
European
skin, or do
skin,
you mean?
yes,
Okay.
European type of skin. So, that is why all of us, around the world now, we are trying to expand those clinical images so that you can see the different kinds of skin diseases in the population all over the world. Like, for example, even redness,
Mm-hmm.
erythematous lesions, they appear different
Mm-hmm.
in skin of color. So, even that is something that, is to be highlighted. This is just an example.
So even in a country like yours, where there's a lot of folks that have darker skin types, there was a lack of representation in teaching materials about dermatologic conditions in darker skin types. Am I hearing that correctly?
I won't say that because,
Okay.
when we are dealing with our own clinical emergency, it's just the kind of patients that we are, our normal population. So we may not be thinking about it as skin of color. We are thinking that it's the kind of patients that we see in our OPD. But I think in the global context, maybe these images have to be used. One could be, say, India, for example, because it has a diversity, and many other places. It could be places in Asia and Africa. For us, we have lot of color images, we have lot of atlases, but these need to be incorporated in the different global atlases to make people aware. So, in fact, if I may say so, I'm also one of the board of directors on the International League of Dermatological Societies, which is the umbrella society of all dermatological societies. So that also is trying to help in getting these images done and is paying a lot of attention to the skin of color images, which should be available to a lot of people around the world, making diagnosis easy.
And I think that is really well said because as dermatologists, no matter where we are in the world, we should be able to accurately and effectively diagnose people with skin conditions, regardless of their skin tone, race, and ethnicity. This is the case for every other organ that we have in our body.
Right.
And I think that should be the case for the skin as well. And part of that challenge, obviously, is having diverse images and research in various contexts so that we can take care of, everyone. And in this increasingly global and connected society, that's really, really important. I'm Dr. Adamson, and I've been speaking with Dr. Rashmi Sarkar about the term skin of color. You can find a link to the paper in this episode's description. This episode was produced by Daniel Masisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.